Plastic Surgery Talk, brought to you by Mentor, maker of memory gel breast implants.
Welcome back to Plastic Surgery Talk. We're here with Dr. Joe, and we're going to answer some viewer questions. But first, I just wanted to bring up, you've written a new book. It's called Your Body, Your Beauty, and Your Safety. We just had Peter Fedora on 2 weeks ago, and he brought his book, but you just have a recent book as well. Tell us a little bit about this accomplishment.
Well, I think this would be a good book for the readers because it talks about finding the right plastic surgeon for you. It talks about qualifications. It talks about how to be a good patient. And so it really puts things in perspective for you so you can kind of make sense of who's the quacks in town and who are the real doctors.
I've looked at it. It's a great read.
Thanks.
And tell us just briefly, how do you pick a plastic surgeon?
Well, you want to look for if they're board certified through the American Board of Plastic Surgery, and if they've had the appropriate training. You know, there's a doctor down the block from me who's doing breast augmentation, and he had a dermatology residency. He hasn't done any surgery residency. And all the patients who are going there, they don't get that. They don't understand how to distinguish that. So I try to help them out with that in the chapter on how to choose the right surgeon for you.
Okay, Joe, we're going to look at some of our viewer questions. Let's take a look at the first one.
My breasts are large and saggy, but they're also heavy. I understand that breast tissue is heavier than the implants. Can I get my breast tissue removed and get replaced with gel implants that are smaller and lighter?
Okay, so what do you think?
Yeah, it's very rare to put in a breast implant for breast reduction. Some surgeons do that, but that is like 1 in 1,000, and that would not be appropriate. Plus, no insurance company is going to pay for that one.
But the beauty is, and you already said it in our last segment, when we do these breast reduction techniques, we're removing a significant amount of that heavy breast tissue.
Right.
I mean, sometimes up to, in really large patients, 4 to 5 pounds per side, which so it can be significant.
And the weight difference between the breast and an implant, although I haven't looked at a study, I don't think is significantly different, especially with silicone.
I agree. That would be, I think, an uncommon thing that's probably seldom done.
Yeah.
Okay, that's great. Let's take a look at our second question.
Okay.
I've heard that a breast reduction might make my breasts look square. Is that a result of a particular technique, or is it something I should be concerned about regardless of the procedure that's used?
So the squarish looking breast, what do you think?
Yeah, I mean, that's something you want to avoid if you can, but that happens to me. I think it happens to everybody, but basically, you know, in nature, a natural breast is roundy, and so you don't want the square look. A little bit of that comes back to what your initial anatomy was. And I think, you know, again, it goes back to this isn't a cosmetic procedure, but we want it to look good anyway, but it's a procedure to relieve pain and suffering. But I would say a boxy breast, as we call it, is unusual.
Yeah. And, you know, you just reminded me of another quick question that I'm going to let you just expound on just for a minute. But when we do a breast reduction, do you always remove the nipple? Because patients ask that.
Yeah, that would be pretty unusual. We usually keep the nipple attached. The chance of numbness in the nipple area is 3%. I've had one patient in over 1,000 who couldn't breastfeed. Otherwise, everybody else who tried could breastfeed. And again, probably a few percent of patients will take the nipple completely off and put it back on.
That's great. So here's one last question for you, Dr. Joe. Can breast reduction be combined with other mommy makeover procedures, such as a tummy tuck?
Sure. There is a common combination that we do, and it usually is breast or tummy, and that's because people want to get back to what we call BC, or before children. And they have the mommy makeover where it's a breast enlargement and lift, or whether it's a breast reduction and then a tummy tuck to go along with it. And I'll tell you, people that have breast reductions don't see their tummy until after the surgery, and then they wish they had done something. So it's something we do mention, but we also have to be real careful of the blood supply, real careful when people are smokers and any kind of risk factors that might get going from a much longer procedure.
And they're some of the happiest patients in my practice.
Yeah,
I'm sure yours.
My happiest patients are breast reduction patients, right?
So it's been really great having you here. You've given us some great insight into breast reduction and other procedures as well, so thank you very much.
Yeah, my pleasure.
So thanks for joining us, and make sure you send us your tweets on Twitter and send us any questions to info@theplasticsurgerychannel.com. We'll see you next time. Until then, have a great one.